Hey everyone, it's Sarah, the registered nurse, RN.com, and in this video, I'm going to be talking about diaper rash. So what exactly is diaper rash? Well, diaper rash is a skin irritation that is found on the buttocks or the genital area in an infant or a toddler. And this skin irritation will present as a reddened rash that you're going to find either on the butt cheeks, in the cleft, which is the crack along the child's backside, or the folds around the genital area. Now this reddened rash can be flat on the skin, or it can be slightly elevated, bumpy, or scaly in appearance. And whenever you touch it, it may be warm. And this rash is extremely painful for children, especially if they have moderate to severe cases. Now, if this rash worsens, it can actually begin to bleed and scab, which again is going to cause your child even more pain. And if you notice that your child's diaper rash just isn't getting better, they're having more severe pain, it's looking even more red, you definitely want to consult with your child's pediatrician. So what causes diaper rash? Well, many things can cause diaper rash to develop. Some of the most common causes include the following: diarrhea or constipation. And with diarrhea, diaper rash can actually come on pretty fast. And this is because whenever your child is having frequent watery bowel movements, it's really acidic and it affects the skin's integrity. Now with constipation, what can happen is that the stool can become impacted and it can lead to a condition called encopresis. And this is where watery stool will leak around that large mass of impacted stool, which will cause skin irritation. Another cause is infrequent diaper changes or excessive sweating. So the key here is that when your child's bottom remains moist for extended periods, it's at risk for diaper rash. Food intolerance or allergy can lead to this as well. Using abrasive fabric whenever you're cleaning the child, product sensitivity can do this as well, such as creams, ointments, powders, fabrics, or detergents. In addition, medications. And then lastly, yeast or bacterial infections. Now let's talk about some diaper rash treatments and remedies. So because diaper rash can have so many causes and actually present as other skin conditions, it's really important that you have your child evaluated by a pediatrician to confirm the diagnosis and get specific treatment. But here are some general tips to help you with most common types of diaper rash. One step you can take is to avoid using scented products because your child may be sensitive to those and it could lead to diaper rash. Next is to change your child's diaper frequently. So if your child is experiencing a lot of urine output, or they're excessively sweaty, or putting out a lot of bowel movements, you want to make sure that you're checking that diaper. Also, consider eliminating any sensitivities your child may have to foods. And most common allergens or sensitivities that children tend to have are to dairy, wheat, eggs, or fish. Another thing is to give baking soda tub baths. So I would get their tub that they used whenever they were small because I wanted to conserve water, and I would sprinkle some baking soda in there, just a sprinkle or about 2 tablespoons, and I would make sure that the water was warm, not too cold or not too hot, and I would put them in that bath, and I would do that frequently. So let's say they had a bowel movement, I would go clean them from their bowel movement, then I would put them in the tub and just let them soak in there and just play in there. That really soothes that red area and helps remove any other stool fragments that may be on the side. And then I would just gently pick them up and just, like, in a sense, dunk their bottom in the water just to help wash that area out. Another thing is that whenever you go to clean your child, you want to make sure that you're using a soft, warm cloth. Unscented wipes are great, they help get the job done, but I have noticed that whenever we have a severe case of diaper rash, that actually causes my child pain. So get a soft cloth with warm water and just dab the area, and dabbing will actually remove that stool from the area. Avoid rubbing the area to try to remove it because that's really applying a lot of pressure and pain to the skin. Another thing you can do before you apply creams to the area in a new diaper is to let the area dry completely. And how I would achieve this is that I would use a hair dryer, and on my hair dryer is a specific setting that I can set it to where it's the cool setting, so it's not putting out any heat, won't burn the kid. So if you do that, make sure you're using that setting on your child. Next, you want to make sure that you're using some ointments and cream on that area because that's going to help soothe the area. It's going to protect it from any moisture that it's going to come into contact contact with, and it's going to promote an environment where it can heal. So what I like to do is I like to get A&D ointment. I find it works better than standard petroleum jelly. And I take a cotton swab, dip it in there, and then take it and apply a really nice thick layer over the diaper rash area. Then I get a new cotton swab and I use a product that has a good concentration of zinc oxide, because that is what's best for those moderate to severe cases of diaper rash. So I take that zinc oxide on that new cotton swab and I spread it over the A&D ointment. And you can alternate cream or ointment over time as you like, and as you see what's really helping heal your child's diaper rash. And after you place this ointment or cream, you always want to make sure that you're applying a fresh, new, dry diaper. And finally, another effective thing that I have found that helps with diaper rash is to just let it air out. So give them times throughout the day to go around without a diaper. And if it's warm outside, let them go outside and play. With my children, what I'd like to do is just put a t-shirt on them that's long enough that comes to their knees so they're nice and covered up, but they don't have the diaper. So that air can hit that and they don't have that hot moisture on that rash, which tends to make it worse. Now, how long does it take for diaper rash to clear up? Well, using all the things that I just went over with my children, if I followed those, generally I would start to see improvement in their diaper rash in about 2 to 3 days. Now, it wasn't completely healed, but I could tell we're not actually taking a turn for the worse. We're getting better. But let's say you do all those things, you notice it's just getting worse. Well, it's time to really consult with your pediatrician for advice. Okay, so that wraps up this video on diaper rash. And if you'd like to watch more videos in this series, you can access the link in the YouTube description below.